Bam, ba-da-ba.
Going through cancer treatment with chemo and radiation is tough, but talking about having a baby after you've dealt with cancer can be a challenge all on its own too. But here to help and offer some hope, Dr. Lila Schmidt from Alvarado Hospital and cancer survivor Magda. Great to have both of you here today.
Thank you.
Thank you.
This is a touchy topic because it's just, there's so many challenges with going through cancer, and then you think about, you know, you make it through to the other side, there's all this hope, and now you go on to another challenge.
Exactly. And a lot of people come in trying to have a baby and don't know they actually already have cancer. So there's two sets of people who have cancer and know it and want to have children afterwards, and some people who are seeking fertility therapy and don't even know they're sitting on cancer already.
That's where, Magda, you come in, because you and your husband married, you wanted to have a family, you weren't successful, you decided to seek fertility treatment, you go into Dr. Schmidt, and then what happens?
So we started fertility treatments in 2002, and we weren't successful. We had several miscarriages, and I started to speak with a few friends who encouraged me to have a second opinion, and that's when I found Dr. Schmidt. And I went in. The first thing she did was an ultrasound, and she found in very early stage ovarian cancer. She saw a very small tumor on one of my ovaries. And as a patient who was going through fertility treatments and wanted a baby, wanting to get, to have a family, this was a big shock.
Wow. I can only, imagine how that must have felt. The happy news is that through going through treatments, and we'll explain more about that, you were able to get through it and have a family.
Correct.
Yeah.
Correct.
So Dr. Schmidt, tell us how that all happened.
Well, like Magda said, she came in as a second opinion, and one of the standard of care to see a patient for the first time is to do an ultrasound as well as a pelvic exam. And when I did my ultrasound, I mean, my jaw fell on the floor. She had classic ovarian cancer. I could tell by the ultrasound. And so then I had the position of saying, well, you're in infertility treatment, you're not having success with someone else, but we have a bigger problem right now, and we need to derail the fertility and work on the cancer.
Let's pop up the pictures, because you have 3 beautiful and amazing children.
Right.
That I just want to give everyone hope that it is possible. And so tell me who these beautiful guys are.
One of them is Andre. He has the curly hair and is looking slightly down, and the other one is Yanni.
And these are your 2-year-old twins?
These are my youngest. Yanni's in the forefront here with the blue shirt, and Andre is with the red shirt. They're both 2.5.
Oh,
they
my
were
gosh.
born.
And they have a big brother. I'm
Yes.
guessing that he's
Trajan.
in charge.
Yes. He's in kindergarten this year. He's almost 5.5.
Oh my gosh. So such a hopeful end of the
And
story.
this is our whole family with my handsome husband, Joel.
He is a looker. So Dr. Schmidt, what was the course of action that you took from that? So if other people are watching today and thinking, my gosh, I want to get where Magda is, what are some options for folks?
Options are see a reproductive endocrinologist. All OBGYNs are great. They're trained a little bit in fertility. They have some experience in ultrasound. If they've had a personal interest, they may have some more, but most of them only have 2 to 6 weeks of training. Where I did a fellowship, it's a 3-year program just in infertility, PMS, and menopause. We're known for the infertility because that's what's on the media. And doing an ultrasound with an MD who is boarded in reproductive endocrine is something that's very helpful. I mean, like I said, Magda, and she's not the only patient I've had who by ultrasound I've diagnosed cancer.
So going through this, what are some of the procedures that women can go through? There are different options, chemo, radiation, and what are some special considerations that after women get through the cancer treatment that they need to know about fertility?
Well, it depends on the cancer. I mean, this month is breast cancer month. So you need to know, depending on where the cancer is, if it's breast cancer, uterine cancer, ovarian cancer. Now, Magda, in the sense, was diagnosed very early, which is a blessing, because surgical care took care of her cancer, which is great. And that's why I sent her to Dr. Pisani within minutes. I mean, I had him on the phone within an hour. And if she does have a diagnosis that's further along, besides doing surgery, then you can also do chemo, but chemo affects your entire body, but you can also do radiation. Radiation, you can take the ovaries surgically and kind of tuck them up out of the pelvis, and so that way they're out of the radiation field and try to save their future potential of having, eggs for babies.
So you were successful in the treatment, Magda. You were successful in this whole process. So I guess kind of looking back on this experience, seeing your beautiful family, what would you want to tell other women that are going through some cancer treatment right now that hope to have a family someday?
There is hope. There's tremendous hope out there. For me, I had two keys. One was having a doctor that I trust, that I didn't second guess, that I knew she was up to speed on the protocols and the latest technology and what can be done, and had my best interest at heart and would customize the care. And the second aspect of that is a support group. Having a support group that you can lean on when you're a patient, as a couple, and just as a woman. But cancer can affect the husband or the wife.
Thank you so much for coming on and sharing your really inspirational story. And Dr. Schmidt, it's just wonderful to hear there are options, there is a treatment plan, everybody is unique and different, but get in as soon as you can and find out what those options are for you.
Exactly. Cancer is no longer a death sentence. It can be a sentence to, I'm going to be a mom someday.
Yeah. Great.
Yeah.
Thanks, you guys.
You're welcome.
Really uplifting.